Hello and welcome. Today we're diving into a really important topic, thyroid function during pregnancy. This might seem like a complex subject at first, but it's essential to understand as it plays a huge role in both the health of the expecting mother and the development of the baby. In this video, I'll explain why monitoring thyroid function during pregnancy is so crucial, which tests is necessary, and what specific things to keep an eye on. Section 1. Why is thyroid function so important? First things first, the mother's thyroid function has a direct impact on the development of the baby's thyroid. The baby's thyroid begins to develop in the first 12 weeks of pregnancy. In fact, the baby's thyroid gland can be detected as early as in the 25th day of pregnancy, and by around the 10th week, it starts absorbing iodine and producing thyroid hormones on its own. Pretty amazing, right? During this initial phase of pregnancy, the baby's needs for the thyroid hormone T4 is entirely met by the mother's thyroid. If the mother has a significant thyroid hormone deficiency, known as hypothyroidism, and is also iodine deficient, this can lead to developmental delays in the child later on. That's why it's so important to monitor thyroid levels, ideally even before becoming pregnant, to ensure the baby is well supported from the very beginning. Section 2. Key hormones and their role. A crucial factor in thyroid monitoring is the hormone TSH, which regulates thyroid function. Interestingly, TSH has a structure that's very similar to that of beta-HCG, the pregnancy hormone that rises rapidly during the first 3 months to support the pregnancy. Because of this similarity, high levels of beta-HCG can interfere with TSH levels. So, in addition to monitoring TSH, it's important to check the free T4 levels in the blood. Free T4 provides a more accurate picture of thyroid function and helps ensure that the baby's thyroid needs are fully met. Section 3. Regular monitoring and dosage adjustments. To maintain stable thyroid function during pregnancy, blood tests should be done approximately every 4 weeks. If needed, thyroid hormones dosage can be adjusted accordingly. The goal is to keep the mother's thyroid hormones balanced to ensure optimal support for the baby's development. A severe deficiency in thyroid hormones, although rare, can have serious consequences for the baby. However, as long as regular checkups are done and adjustments are made as necessary, there's usually nothing to worry about. Section 4. The role of an endocrinologist and thyroid ultrasound. In some cases, the gynecologist can refer a pregnant patient to an endocrinologist. This specialist can perform more detailed thyroid function tests and, if needed, conduct a thyroid ultrasound, also known as a sonogram. This imaging allows doctors to observe the structure and the characteristics of the thyroid gland and detect any irregularities that might suggest a potential future thyroid deficiency. Such insights are helpful for planning treatment after pregnancy as well. Section 5. Importance of thyroid function for baby's development. The baby's health development is closely tied to the mother's thyroid health. A significant thyroid hormone deficiency could have serious implications for the child. The good news is that monitoring and treatment are both straightforward and effective. With regular checks and small dosage adjustments, risks can be minimized, so there's no need for mothers to be overly concerned. Section 6. Referral for elevated TSH and Hashimoto's thyroiditis. When the gynecologist detects elevated TSH levels, they often refer the patient to an endocrinologist for additional tests. The endocrinologist will likely check free T4 and anti-TPO antibodies and perform a thyroid ultrasound if necessary. These tests help determine the cause of any thyroid issues. A common cause of hypothyroidism in women in childbearing age is Hashimoto's thyroiditis, an autoimmune disease in which the immune system attacks the thyroid and impairs its function. Women with Hashimoto's should have their thyroid levels closely monitored, especially during pregnancy. Section 7. Thyroid function and fertility, an important topic. Thyroid health is not only important during pregnancy, but also when planning in pregnancy. Women with elevated NITPO antibodies have an increased risk of miscarriage and preterm birth. For this reason, thyroid testing, including thyroid ultrasound and anti-TPO antibody checks, is often recommended as part of a fertility workup. These tests can help identify and manage potential risks early on. Section 8. Starting dose for hypothyroidism and iodine supplementation. When hypothyroidism is diagnosed, treatment is usually started with a dose of 50 micrograms of levothyroxine daily. That's for pregnant women. No? Additionally, the mother should take 150 to 200 micrograms of iodine, provided no anti-TPO antibodies are present. The goal is to bring the TSH level down to around 1. If the woman was already taking levothyroxine before pregnancy, her dosage will be typically increased by about 50% as thyroid hormones needs rise during pregnancy. Conclusions. In summary, the thyroid is a small organ with a big role, especially during pregnancy. Maintaining proper thyroid function is crucial for the baby's health development. With regular blood tests, ultrasound scans if needed, and appropriate medication adjustments, expectant mothers can ensure both their own health and their baby's well-being. Thank you for watching, and if you found this video helpful, please subscribe to our channel for more health tips and information. See you next time.